Instructions to administer the medication. Menopur 75. Before administering the medication, read the following instructions carefully. Wash your hands properly before preparing and administering the medication. Try and choose somewhere clean and peaceful to prepare the medication. Make sure you have all the necessary material ready for the injection. At your pharmacy, you must get alcohol, medical gauze, and a suitable container to dispose of the material after using it. The medication that is kept in the refrigerator must be taken out 5 minutes before using it, so that it is at room temperature at the time of the injection. To improve the effect, try and administer the medication at approximately the same time every day, preferably at midday. Don't worry if there is a minor local reaction, such as redness, itching or pain in the injection site. That is normal due to the effect of some of the drugs used. If it lasts more than 24 hours, seek help at your UR group clinic. Once the medication has been administered, dispose of the material used in the container. If you have any questions, you should get in touch with your UR group clinic. The method to prepare and administer your medication is as follows. The Menopur 75 pack contains vials of powder, ampules of solvent. You will have collected the administration kit from your UR group clinic beforehand. Take an ampule of solvent and a vial of powder to prepare 75 units of Menopur. From the kit box, prepare a syringe, a needle for the intramuscular injection, and a needle for the subcutaneous injection. Use medical gauze to open the ampule of solvent by pulling the tip backwards towards you. Remove the blue top of the vial of powder. Put the needle for the intramuscular injection into the syringe and draw out all the liquid from the ampule of solvent by pulling the plunger. Put the vial of powder on the preparation surface vertically. Stick the needle in the center of the rubber stopper of the vial of powder. Slowly press down on the syringe plunger so that the liquid goes into the vial of powder. Try to make it flow along the wall of the vial to stop air bubbles forming. Do not shake the vial. Without letting go of the plunger and without taking out the needle, roll it around on your fingers until the powder dissolves completely. This is how you will stop air bubbles forming. Once it has dissolved, draw out the solution into the syringe by inserting the end of the needle in the bottom of the vial and tilt it gently. Do not let go of the plunger until the needle has been removed completely so that the liquid does not go back into the vial. Change the intramuscular injection needle for the subcutaneous injection needle. With the needle facing upwards, tap the syringe a few times to get the air bubbles together so that you can expel them easily by slowly pressing down on the plunger until a small drop of liquid appears on the tip of the needle. The medication must be administered immediately after it has been prepared. Injection in the abdomen. The medication must be administered in the anterior area of the abdomen, about 3 fingers away from the navel. The injection site must be changed every day to improve absorption and to avoid any possible discomfort. Clean the injection site with medical gauze soaked in alcohol. Pinch the skin with one hand. Insert the needle completely, holding the bevel upwards at an angle of between 45 and 90 degrees to the skin. Inject the whole dose, pressing down on the plunger of the syringe slowly and constantly until it is empty. Wait for 5 seconds. First let go of the skin and then gently remove the needle. Apply pressure on the injection site with medical gauze for a few seconds and gently massage the area. This will favour the dispersal of the medication under the skin. If you have a suitable disposal container, put the used needles in it without putting the caps on them. If you don't have a suitable container, put the caps back on the needles, being very careful not to prick your fingers, and keep them somewhere safe until you can take them to a UR group clinic, where we will be able to dispose of them for you. Remember that you must not reuse the needles or share them with anyone else. Keep Menopur somewhere dry. at room temperature no higher than 25 degrees Celsius and in its original packaging to protect it from the light until it is used again.